Hi friends. In the earlier videos, we saw about what is the health information system, then what are the types of medical data that are stored, and we came to know that there are some softwares in the market that are used to track and manage the medical data, like EMR as well as EHR. So, come let us see about some of the softwares that are available in the market already. Instead of showing you the most recent type of apps, I decided to show you a software that has been used 10 years back. So this is when initially when the hospital started using technology, started using digital thing in their healthcare setup. This is like 10 years back. So CareView is the most common among all those applications, healthcare based softwares that came back then. So this care view, this application is all about virtual patient care. Like normally the nurses will be showing up, right? They'll be doing rounds to check on their patients, and especially in foreign countries like America, the family members they can't afford to sit throughout the entire stay period of a patient, right? So there will be hospital sitters who will be taking care of the patients. They'll be checking on the patients every 15 minutes and reporting it to the that wards nurses about their status, about the patient's requirements, providing them emotional support. So this CareView app is gonna reduce the burden of those hospital sitters and nurses as well. What it does is uh, the patients are admitted in hospital, right? In each and every room of the in-house patient, there will be a camera, an infrared camera, along with a specialized computer that will be attached to the patient's room. It will have as usual, it will have the keyboard, and also they'll give a remote to access the monitor. So with this camera access, the nurses can monitor the vitals of the patients who are admitted directly in their staff room without disturbing the patients. They can also, it also enables the family and friends of these patients to pay a virtual visit to the patient's room anywhere in the world. Like every caretaker of that particular patient will be getting a visitor access card. In their visitor access card, they'll be given a password. Using this password, they can use this CareView mobile app and request to connect to the monitor of that particular patient, their relative who is admitted in the hospital. Now, this will prompt a message to the patient's device like, this patient, your relative John wants to access your camera. Are you ready? So, if they say yes or no, based on that, the caretaker, the family member, they can see their camera. It will be not like a video conferencing thing, but just like a CCTV camera setup. They can, it's a one way communication, right? Like only the visitor, they can see the patient. The patient can't see the visitor, but they can chat using their portal. They can send messages to the family member or the nurse, and all they can do voice messages also through the audio calls. They can do through the mobile app, through the CareView mobile app if they have mobile device with them. So what in addition, what all these CareView the software does is that it also provides entertainment services to the patient. Like the patient will be getting bored, right, sitting in the hospital all day. So based on their package they have paid, they can gain access to some TV shows, movies, etc. Just like our Prime membership or the Disney Plus membership, they can access based on the package they have paid. Also, they can access the internet facilities and try to educate themselves instead of getting bored all day. In addition, in order to preserve the privacy of patients, they also have a privacy mode, right? Because there is a camera, so the nurse or your relative, anyone who wants to monitor check on the patient, they can see them anytime, right? So if the patient is doing some dressing, or if the patient wants to do something that they want it to be private and not to be seen to everyone, they can press the privacy lock button in their monitor, and then for a few minutes their screen will be hidden, so even the doctor or nurse, they can't access it virtually. till that timer expires. So the patient's privacy is also preserved. They won't feel that their privacy that is at risk. So what are the facilities offered by this CareView is that it allows the nurses to check on their patients remotely and to check their vital signs as well. And it also has motion sensors. So they can track if the patient is falling down because it will have a rapid movement, right? If they are falling off the bed or they're falling down while walking, it will track and send notification. Then what else it does? It allows the nurses and the patients to set reminders. It sends them notification if any event is happening. Then it allows the patient's family and friends to view them remotely and connect with them through chatting or voice calls. Then it also helps the patients to watch movies, entertainment, to access the internet and gain some education. Um, so back then, 10 years back, this was a huge advancement. It was very beneficial to several hospitals. There are so many hospitals who have mentioned that this has reduced their load very much, and it has there are so many testimonials. I'll attach the link in the description. You can have a look at the CareView platform as well. Next video, we will see about one more software application called MetaVision. Okay, thank you.